Our next presenter is Bridget Gardner. Bridget Gardner is the Principal Director of HPC Solutions and has 20 years' experience in the cleaning industry as a trainer, auditor, and document writer. She is a frequent contributor to the industry journals and conference presentations. In April of this year, Bridget wrote the Guide to Cleaning for COVID-19 and is currently working with the Victorian Department of Health and Human Services to produce guidelines for cleaning in non-healthcare buildings.
So thank you for inviting me to speak at Lifesaving Victoria's first virtual aquatic industry summit. My name is Bridget Gardner and I'm Director of High Performance Cleaning Solutions. I've been providing advisory and training services to facility managers and cleaning service providers since 2006 and working in the industry for 20 years. Back in April of this year, when the coronavirus hit, I wrote a guide to cleaning for COVID-19, and I've currently had the pleasure of working with the Department of Health and Human Services to produce cleaning guidelines for non-healthcare buildings. That means aquatic centres and all buildings across Victoria. So I thought it would be a really good idea to start my presentation with a quick refresher on how coronavirus is spread and why cleaning and disinfecting is such an important way to prevent the risk of infection from frequently touched surfaces. COVID-19 is mostly spread via respiratory droplets, human-to-human contact, and also the surfaces and objects that can become contaminated when someone who is infectious coughs, sneezes, or touches them. And then the germs can be spread to people when they touch their nose, their eyes, their mouth with their hands, or other personal items such as their phone or clothing that has been in contact with that contaminated surface. So to address this risk, the Victorian Government's COVID Safe Plan includes requirements for you to increase environmental cleaning, ensure high-touch surfaces are cleaned and disinfected regularly, at least twice daily, and ensure you've got adequate supplies of cleaning products such as detergents and disinfectant. But I'm actually not going to speak about how to clean high-touch surfaces today. Instead, I want to talk about who cleans them, because the management of this highly casual workforce is as important as the management of cleaning itself, as I'll explain in the first half of this presentation. Then in the second half of my talk, I'm going to share 4 strategies with you that you can implement in your aquatic centre to help prevent the spread of COVID-19 in partnership with your cleaners. Since Melbourne's hotel quarantine program infected some security guards, it's become really clear that the casual workforce is at the epicentre of the second wave of coronavirus. In the words of one reporter, it's churned through them. Casual workers are often migrants, students or young parents, and being on minimum wages, they may have to hold down 2 or even 3 jobs, and they're constantly moving between these different workplaces. Hence the title of this session, Uber driver by day or aged care worker by day, and cleaner by night. So the hotel quarantine inquiry identified several reasons why the casual workers have a higher risk of spreading the virus. The first is that they often have limited English skills and a poor understanding of the rules of community spread. Second, and importantly, they can't afford to isolate for 2 weeks, and $300 doesn't pay for 2 weeks of staying off work. And the third reason is that with no job security and young families to feed and rent to pay, etc., they're scared of losing their jobs if they do isolate. So they keep working, they keep quiet, and they hope for the best. And this is a really, really big problem, especially for Victoria and especially for cleaning services. Because according to a 2019 parliamentary inquiry, there are over 2.6 million casual workers employed in Australia, and that makes up for 24.4% of all employees. In Victoria, there are 95,000 casual cleaners and laundry workers, and 41.5% of them are casual. And most other cleaners are actually permanent part-time, and that carries exactly the same type of risks. An investigation by the Australasian Centre for Corporate Responsibility into the impact of coronavirus on vulnerable workers concluded that subcontracted cleaners posed a significant risk of workplace transmission of COVID-19. The lead author, Dr. Katie Hepworth, identified 3 core issues through their research. So the first issue is that current contracts are not sufficient in terms of staff and hours to cover the additional cleaning and hygiene and safety requirements. The second problem is that cleaners aren't being provided with safeguards to protect themselves from the virus, including fit-for-purpose personal equipment. And I'm sure you've all seen images on the media of cleaners in hazmat suits and proper respiratory gear, but that's actually not what's happening in most of the buildings around Australia. And cleaners are not being provided with sufficient training in how to carry out their work safely and how to clean building surfaces properly. At this point, you might wonder how relevant this is to an aquatic centre. So I thought it would be a really good idea to explore a recent outbreak and see how it unfolded and the impact that that had on the public venue and the people that used it. Chadstone's Butcher Club outbreak. The Butcher Club is a butcher shop in the middle of Chadstone Shopping Centre. The first confirmed case happened way back on the 25th of August, when a cleaner who was meant to be isolating worked at the Butcher Club. We now know that she was actually part of the Frankston outbreak, where 11 members of one family had tested positive, but unfortunately she didn't inform her managers or the butcher shop of this. Then on the 29th of September, a whole month later, a second confirmed case of COVID-19 was identified in a staff member of the Butcher Club. By the 30th of September, it had spread to more Butcher Club team members, plus members of the general public that had visited Chadstone in the previous week. And by the 6th of October, staff members from 2 other Chadstone stores were infected and had to close, including a clothing shop and a cafe. So by the 9th of October, there were 31 active cases linked to Chadstone, and the manager of the Butcher Club was in ICU. And then a delivery man linked to the Butcher Club travelled to Seymour, sat in a cafe where he infected more people. And just yesterday, the DHHS found out that it was this same driver who caused the outbreak at a tyre shop in Shepparton. And importantly, because he failed to inform the contract tracers, the virus has been allowed to spread. So as a result, at least 6 businesses have had to close, be deep cleaned and disinfected, which costs thousands. And all associated staff and family have had to stay in 2 weeks isolation, and some are very ill. And all this disruption and pain was caused by one cleaner who failed to self-isolate when her family members were diagnosed with COVID-19. The DHHS said that in some cases there were only casual contact with this cleaner, and that contact could have happened in facilities like public toilets, and it might have actually contributed to the transmission, which just goes to show how infectious it is, but also makes me wonder whether the surface to human transmission was a factor here. So the second part of my presentation, I want to talk about solutions. The DHHS's COVID response teams, they're the ones who go out and check that the building has been cleaned so it can go and open back up again. They told me they were shocked at how poor the cleaning was and the communication was between the occupiers and the cleaners in the outbreak situation. No one knew who was doing what. They stressed how crucial it is that both parties work together to help stop the spread of COVID-19 through the community. So I really recommend you take a more proactive, collaborative approach now towards the management, delivery of your cleaning service that you might have been used to. So today, I'm going to share with you 4 key strategies, and that will help you ensure that your cleaning service provider is delivering adequate levels of hand and surface hygiene, supervision and training, physical distancing, and scheduled duties and hours. And these strategies are so important because they're going to give you confidence that you're doing everything you can to protect your cleaners, your staff, and importantly, the public who use your aquatic centre. So let's start with hand and surface hygiene. So now is a really good time to fit out your cleaner's room with ventilation and running water like you've been meaning to do for ages, so that they have proper cleaners' sinks and cloth laundering facilities. Because honestly, we really can't expect cleaners to take hygiene seriously unless they're given a workspace that allows them to take it seriously. When I ordered a cleaner's room, this is what I'm looking for. I want to see a chemical dispensing system so that I know that the detergents and disinfectants have been accurately diluted, because otherwise they're not going to work properly. I want to see cloths and mops that have been properly washed in washing buckets at the minimum, or washing machines preferably, and that they're being hung to dry or they've been dried in a dryer. I want to see that there's proper hand soap, that there's alcohol hand sanitizer and plenty of gloves, and that they're being supplied in the cleaner's room and carried on the carts. And this is really important. I want to see posters displayed on the walls, because I want to know that the cleaners have been told and taught how to wash their hands properly, how to use hand rub properly, and how to remove gloves safely. Because unless they do that, they'll be recontaminating their hands and spreading the virus around the building as they clean. And this is what I don't want to see. And unfortunately, these photos were taken in real buildings. I didn't set them up, from all the cleaning audits I've done over the years. And yes, that's toilet brushes sitting in the bottom of the buckets on top of the cloths that are being used to clean the kitchen sink. And sure, there's colour coding, but the cleaner's hands are going to be touching the bottles, spreading germs around your facility. Okay, so our second strategy is about supervision and training. Can I ask you, are you confident that your cleaning contractor would have known if one of their team members needed to self-isolate? Because honestly, I don't believe there's any excuse for that cleaning company that employed the super spreader cleaner at the heart of the Butcher Club outbreak. How should they have not known that that cleaner needed to self-isolate? That's a big red flag for me. As part of our guide to cleaning for COVID-19, we provide a set of procedures, and one of those procedures is called the Procedure for Managing Cleaning Staff During a Pandemic. I put a copy of that up on the slide so you can see some of the requirements in it, but one important one is that the cleaners must sign their agreement to inform the company if they need to self-isolate. But importantly, to support that, there's also the requirement that the company nominates what I call a COVID champion, but you can call them whatever you like, but basically it's someone who's going to have constant contact with the cleaners so that they are checking in on them, making sure they're well, making sure that their family members are well, so that if something happens, they know. The second procedure I wanted to highlight was a standard operating procedure for cleaning and disinfecting high touch points. And this requires managers to report and communicate to other team members if a cleaner has had to self-isolate because they're sick or their family members are sick. So I really recommend that what you do is you talk with your contractors and you find out what procedures they've got in place for managing their staff and what assurances they can give you that their workers will tell them if they have to self-isolate, because clearly this is a very, very important issue. So the second part of supervision training is the training aspect. It's really important that every cleaner is given COVID-19 infection control training. The Department of Health has provided this for free, so there's really no excuse for them not doing it. I recommend that what you do is you ask your contractors for copies of their standard operating procedures or any other procedures that explain their processes, and importantly, samples of the cleaning and training manuals that they're providing to their cleaners. Because what you really need to know is that the cleaning practices they are doing are based on government guidelines, and that the cleaners are being given training in things such as correct handling of cloths and wipes to prevent cross-contamination from surface to surface, correct use of disinfectants, including cleaning first and allowing sufficient contact time, and the correct method of taking off their gloves and masks so they don't reinfect themselves. And finally, you really need to find out that training was done safely. So were they wearing masks and not sharing equipment while they were being trained? Were they holding training sessions outside or in a well-ventilated space that enabled physical distancing? And that brings me to another point that I'd like to explore, and this is your third strategy, physical distancing. Most Safe Work Australia's information about physical distancing is actually only relevant to businesses operating from a fixed location. But physical distancing while cleaning, it has some unique challenges. Firstly, cleaners' rooms are often really small and poorly ventilated. Secondly, if you've got daytime cleaners, they're moving around all of your staff and all your visitors. So if they're infectious, they're going to be spreading them around to everybody. And the third point is that they often work and take breaks unsupervised. And as we saw from the hotel quarantine security guards, if no one is watching them, the temptation to stand close together, looking at each other's phones, sharing cigarette lighters is pretty high. Cleaners working after hours also may need to carpool when travelling to and from different sites. A maximum of 2 people are actually allowed to travel together if it's absolutely necessary for work, but there are restrictions, so they have to keep the windows open, for instance, or the passenger has to sit in the back seat. So is that being done? So I really recommend you discuss these potential risks with the cleaning company. You'd ask to have a look at their risk management plans and then make sure that all these risks are being considered and are being prevented. But if you engage with a really small company, I recommend that you actually sit down with them and work through it, because they're probably not familiar with doing a risk management plan to this degree. And as I said, partnership is key here. But the best tool of all for addressing the challenge of physical distancing is actually our fourth strategy, and that's the cleaning schedules. So when you're looking at the cleaning schedules and scheduling duties, the workflows have to be scheduled in a way that enable physical distancing, and I'll give you a few examples of that. First one would be staggering break times, or setting up physically distant areas so that workers don't have to sit together during smokos, as the tradies in my local area seem to do, I've noticed. Or stagger start and finish times so that one staff prepares all the cleaning supplies, say 15 minutes earlier, then the time the other staff arrived, it's all ready to go and they don't have to be in that cleaner's room in close proximity together. Another idea about staggering start and finish times would be having a cleaner finishing off after everyone else has left, disinfecting the surfaces so there's no risk of recontamination. And I might just explain that point a little bit more, because most people do their high touch points first. And yes, clean it first while the cloths are clean. But I recommend you actually finish with a disinfection, because otherwise they're going to be touching those door handles or taps while they're cleaning and they'll be recontaminating them. And the fourth idea is to adjust the workflows so that one cleaner could be, say, washing cleaning cloths while the other is finishing mopping and waste removal, so they're not working together. So we're going to finish where we started, because scheduling is really important when it comes to the frequent cleaning and disinfection of high-touch surfaces. In a busy public space, I recommend that high-touch points are cleaned throughout the day by your reception and duty staff, as well as the cleaning staff. For this to work effectively, it's really important that what you do is you identify and document the critical high-touch surfaces. And what I mean by critical is this: they're the surfaces that most people touch and at most risk of becoming contaminated. So that's the surfaces in the entry areas. In washrooms, we know that COVID-19 has been found in fecal matter, so washrooms are really critical. And of course, if there is food eating areas as we start to open up, those surfaces are really, really important to become disinfected, because that's how people can contaminate their food and then bring it into their bodies. So the next thing you've done is, once you've listed and identified your high touch points, is you need to schedule when and how often and by whom they're going to be cleaned. I call these charts that I'm showing you on the screen my high touch point cleaning protocols. And they are sold with a guide to cleaning for COVID-19, but you can just draw them up yourself. They're pretty simple. What's really important is that when you're documenting them, you make sure you communicate it to everybody, because it's a very important way to give you confidence that nothing's being missed, but also everyone else will know where and when they need to clean them and that they're being done. And your protocols also need to list cleaning and disinfectant products that are used. I can't stress this strongly enough, because some disinfectants will react with each other. It might be that they actually neutralise the effects, or they could actually create dangerous fumes. So again, communication with your cleaning company is critically important. Now, we get to the part in the presentation, whereas if I was doing this live, people would be asking me questions. This is going to cost a lot of money. So if you calculate the cost of having to close down, decontaminate your centre, have all your staff and family members in isolation for 2 weeks, then I would suggest that increasing your cleaning hours is actually a cost-effective risk mitigation strategy. But if it really is busting your budget, then a second way of doing this is adjusting the schedules so that now you spend less time on things that are less important, such as dusting the skirting boards, vacuuming, wiping minimally touched surfaces, such as the bottom of chairs, and spend more time frequently cleaning those high touch points and on cloth laundering. So in summary, if you partner with your cleaning service providers, you can make sure that they're providing adequate hand and surface hygiene, supervision and training, physical distancing, and scheduling their duties and hours properly. And these 4 strategies are going to give you confidence that you're doing everything you possibly can to protect your cleaners, your staff, and the public who use your aquatic centre. Thank you.